This technique is what we understand. There is no such MRI or in vivo technique for detecting the loss of neurons or reflection of neuronal loss. From that perspective, this technique is definitely a friend compared to other sequence or other techniques. For example, if you look at there are other techniques, for example, PET imaging. They're doing synapses imaging. Some of them are using metabolism. People are using proteins. They are doing best, but with that techniques, you cannot do longitudinal data. So like you cannot perform several times. And our technique is, as I said, that we don't need any contrast. We don't need to inject anything. It's just required on a 6-minute scan. And then we have a post-processing pipeline that can give you results within 20, or now with the deep learning algorithms, you can do it much quicker. Within maybe an hour, you get all the results in hand. But again, as I said, that still it is an interesting technique in terms of looking at the brain pathology, especially in the preclinical AD stage, where right now everybody's after it, especially in the AD field, because now it is largely agreed that Alzheimer disease precedes, at least onset of the Alzheimer disease, at least 15 to 20 years of its clinical symptoms. So every technique is now focusing towards that diagnosis of those region or time window. If we can provide a diagnosis tool within that frame window, it can provide possible interventions or any therapeutic future therapies chances. That's where everybody is after it. And as I said, that we are providing in vivo measurements with the whole brain analysis, structural and morphological and quantitative information of the brain, which could be a game changer if it works in the long run. How it depends on how clinicians adapt this technique. As I said, that it can go into the initial phase of the scanning, where when people comes to the clinic and then say that, hey, we have a memory problem, they go to clinic and then clinicians do some test and add a MRI to see if there is any coexisting pathology. If we can provide such things also, as I said, that this could be a game changer for Alzheimer disease. I don't know Alzheimer disease diagnosis, at least early AD Alzheimer disease diagnosis. This will be giving an additional information, definitely, with what has been existing, what has been done so far.